Minimally invasive hysterectomy. How to care for yourself at home. In this video, you will learn how to care for your incisions, how to manage your pain, what you can do to recover safely, your follow-up appointments, and when to get help. Plan to have someone stay with you for the first 24 hours after surgery in case of an emergency. Within 24 to 72 hours of your surgery, the clinical nurse specialist or another member of your healthcare team will call to check on you. This is a good time to have the nurse answer any questions you may have. You will continue to recover at home over the next 2 to 4 weeks. How to care for your incisions or surgical cuts. The cuts made during surgery are usually closed with stitches and steri strips. Steri strips are sterile pieces of medical tape. The steri strips will come off on their own in about 7 days. You can take the steri strips off if the strips begin to fall off on their own, or they are still on after 7 days. The stitches under the skin will dissolve in 3 to 4 weeks and do not need to be removed. Staples are sometimes used to close cuts. If you have staples, you will need to have your family doctor remove them in 7 to 14 days. You will get a staple remover when you leave the hospital to take to your doctor's office. Check your cuts each day. Look for any signs of infection, like redness, swelling, pain, pus leaking from the cuts. Keep your cuts clean and dry. Gently wash them with mild soap and water. Rinse well and pat dry with a clean towel. Do not put creams, lotions, or powder on your cuts. Clean the cut at your belly button every day after you shower. Use a moist Q-tip soaked in hydrogen peroxide to clean this area. You can buy hydrogen peroxide at most drugstores. How to manage your pain. You will normally get 3 different types of pain medicines. You need to control your pain to be able to move and walk. You will heal faster if you can move and walk about. If the medicine does not relieve your pain, call the clinical nurse specialist. You may get the following pain medicines: naproxen, Tylenol, hydromorphone. Take naproxen exactly as prescribed. You will get an instruction sheet from your nurse on how much naproxen to take and for how long. Always take naproxen with food to avoid an upset stomach. Take 2 extra strength Tylenol tablets every 6 hours for 48 hours. After 48 hours, take only as needed. Do not take more than 4,000 milligrams of Tylenol in one day. Take hydromorphone only if your pain is not well controlled with Tylenol and naproxen. Most patients do not need to use hydromorphone after surgery. You will get a prescription, doctor's order, and instructions on how to take this medicine. As you heal, you will feel less pain and will not need pain medicine as often. You may have some pain in your shoulders due to the gas that was put into your belly during surgery. Walk and move around to help relieve the pain. What you can do to recover safely. There are many things you can do to help recover safely. Here are some things to do and some things to avoid. You can have a shower the day after surgery. Avoid a bath until the cuts are fully healed. It usually takes 2 to 3 weeks to heal. Eating and drinking. Drink 6 to 8 glasses of fluid a day unless your doctor gave you other instructions. Slowly return to your usual diet over a few days. You may find it easier to start with small meals. Healthy eating can give you energy and strength and help you recover. Choose foods that are low in fat, cholesterol, and salt. For more information, see Canada's Food Guide. Go to Health Canada's website and click on Food and Nutrition, then Canada's Food Guide. Dealing with constipation. Constipation is common after surgery. Constipation is when people have trouble having a bowel movement or poo. To avoid constipation, drink 6 to 8 glasses of water a day. Eat foods high in fiber such as fruits, vegetables, lentils, beans, and whole grain breads and cereals. Your doctor may suggest a laxative or stool softener. Both the laxative and stool softener can help to prevent straining when you have a bowel movement or poo. You can buy these at your local drugstore. You can drive after 2 weeks if you have no pain and you are no longer taking strong pain medicines like hydromorphone. When taking long car rides, stop every 2 hours and walk around. Sitting for a long time increases the chances of developing a blood clot. You can go back to your usual activities when you feel ready. Start with light activities in the first week after surgery, such as short walks. Do not exercise for 8 weeks after surgery. Check with your healthcare team first before you start to exercise again. You may get tired easily. Listen to your body and do not do more than you can handle. If an activity causes discomfort or pain, stop and rest before you try that activity again. Things to avoid. To make sure you do not open the cut in your vagina, avoid the following for 6 to 8 weeks after surgery: heavy lifting, high-impact sports like running, weight training, biking, yoga, Pilates, vacuuming, or pushing a lawnmower. Do not have sexual intercourse or place anything in your vagina for 8 weeks after surgery to avoid opening up the cut. Ask your healthcare team when you can resume sexual intercourse. Your follow-up appointments. If you went home with a catheter in place, you will have a follow-up appointment in 1 to 3 days to have the catheter removed. You may have the catheter for longer than 3 days if your healthcare team feels you need it. This appointment will be in the Gynecology Oncology Clinic on the 5th floor at Princess Margaret Cancer Center. If your incisions were closed with staples, make an appointment with your family doctor to have them removed. You will usually have the staples removed 7 to 14 days after surgery. Follow the instructions from your healthcare team. You will have a follow-up appointment 3 to 4 weeks after your surgery to check how well you are healing. When to get help. Get help if you notice bright red bleeding from your vagina, soaking a pad every 2 hours, pain that is not relieved by pain medicine or is getting worse, uncontrolled nausea, feeling like you need to throw up, and uncontrolled vomiting, cannot control throwing up, discharge from your vagina or incisions that smells bad, fever, a temperature higher than 38 degrees Celsius or 100 degrees Fahrenheit, and chills, redness or increased pain around your incision, constipation, trouble having a poo. If you have questions, concerns, or need support, call the clinical nurse specialist for Gynecology Oncology, 416-340-4800, extension 143674. The Gynecology Oncology Resource Nurse at 416-946-4501, extension 3280. If you are calling after clinic hours on a weekend or holiday, call the nursing unit on 10 ES, Consolidated Short Stay Unit at 416-340-3521 or 416-340-3880. For more information on your recovery and other questions you may have, read the pamphlet about preparing for your surgery and recovery at home. In this video, you have learned how to care for your incisions, how to manage your pain, what you can do to recover safely, your follow-up appointments, and when to get help.